Good afternoon, and thank you all for joining us today. It's great to see all of you introducing yourselves in the chat box, and please feel free, for those of you who are joining, to continue to do that. I'm Beth Stroll with the TA Network for Children's Behavioral Health, and I'd like to welcome you to this month's webinar. This session is part of the System of Care Leadership Learning Community. Denise Silsbeck and I co-facilitate this learning community, and we hold it monthly, and it's designed to support leaders in systems of care. So that could be in states, communities, tribes, territories, and includes those both with and without federal grants, and we try to make them relevant for all jurisdictions. It's also designed for leaders with many different roles in systems of care, including those in director roles as well as leaders in various content areas. We try to address topics that are important and helpful to you in your work, and we always welcome your suggestions for future topics, so please feel free to reach out to us with your ideas. This year, we're focusing most of our sessions on operationalizing various elements of the system of care approach, and today's session will focus on operationalizing youth voice and leadership, which of course is a core value of systems of care. We like these sessions to be as interactive as possible, so we encourage you to put your questions, comments, insights in the chat box. And we have also incorporated time for questions and answers, and Denise and I will make sure that any questions you enter in the chat box are addressed. Just below the chat box, you'll see a box that will allow you to download today's PowerPoint presentation and a number of other resources, as well as a follow-up link that you'll receive that has a recording, a link to the recording of this webinar. And also at the end of the session, a link will pop up for a very brief evaluation survey, and we would really appreciate your taking just a few moments before logging out to complete that and provide us with your feedback. We do take it very seriously and use it to improve our future learning community sessions, so we would be very appreciative if you helped us with that. I'd also like to take just a brief moment to mention our learning management system called Ideas at the Institute. This is a platform that allows our learning communities to be more user-friendly and more interactive. And it's a digital hub where you can join the various learning communities, register for webinars, find recordings of previous webinars and related resources, and you can also interact with experts and peers, among other features. On this slide, you'll find the link to sign up, and we encourage you and your staff and partners to sign up and to take advantage of the IDEA system. We're really very excited with that, about all it has to offer. We also want to let you know that registration is open for the University of Maryland 2020 National Training Institutes. That's going to take place this summer in Orlando. There will be pre-institutes training programs on June 29th and 30th on a variety of topics, and then the institutes will take place from the afternoon of June 30th through July 3rd. So we encourage you to budget for this and bring a delegation to the institutes, and we sure hope to see you in Orlando. Now, before we get started, I'd also like to mention that the next Learning Community session is January 22nd, and we'll be focusing on comprehensive school mental health services and how those are linked and integrated with the system of care approach. So we hope you'll put that on your calendar and join us then. And I'd also like to bring your attention to the next Learning Community session from the Young Adult Services and Supports Learning Community that will focus on youth engagement in the policy arena. Our wonderful tech expert, Tiara, will put links to register for those in the chat box, and you'll also get them in the follow-up email that you receive from this webinar. And as always, you'll find information on these and other TA opportunities in our weekly TA telegram. This just shows you what you see when you get onto the Institute's Ideas at the Institute Learning Management System, where you can link to our various learning communities and access the information it has to offer. Again, today's session will focus on youth voice and leadership, and we're very fortunate to have two outstanding presenters from Youth Move National, which is a partner of the TA Network. Johanna Bergen is the Executive Director of Youth Move National, and Madeline Zielinski is a Youth Program Specialist. I'd like to thank them for their great work in putting this session together. The objectives for today's session are to understand the value and importance of youth engagement and leadership, various roles for youth at the system and service delivery levels, how to partner with youth-run organizations, how to use a set of questions as a guide for implementing youth leadership, and also how to use a very practical tool for assessing youth voice and leadership that provides specific indicators in each area that you might be working on. So I will now turn this over to Johanna, who will get us started.
Beth, thank you so much. Thank you, everyone, for joining us to talk about youth engagement in systems of care today. As Beth said, my name is Johanna, and I'm the Executive Director of Youth Move National. We are a part of your TA team supporting the implementation of system of care and here to support you in infusing youth voice throughout your work. I serve as a TA provider throughout the TA network and hope to bring my experience of supporting the Youth Move chapter network, as well as my own experience, which started as a youth advisor in a system of care community in my home here in Iowa several years ago, and really excited to be here with you today. I'm going to pass over to Madeline to get us started.
Thanks, Johanna. My name is Madeline Zielinski. I'm calling you today from Indianapolis, Indiana. I am the Youth Program Specialist here at Youth Move National. I spent 3 years in Indiana as the state coordinator for Youth Move Indiana. We're a system of care community, and I served on a lot of different boards and had a lot of experience within systems of care and youth engagement. So I'm really excited to be here today to talk to everybody about how we can amplify the youth involvement within our own communities. So just a little bit about Youth Move National. We are a youth-led, chapter-based organization. We have chapters in 35 states, 4 tribes, and the District of Columbia. Our chapters are comprised of young adults who have lived experience in mental health and the other youth-serving systems, and they use their voices to improve the quality of these services. Also, just a note, Youth Move National operates as a TA provider within the TA network. You're always welcome to reach out to us if you have questions about youth engagement. Anytime we have that survey form on our website. You're also welcome to contact us directly. Youth Move is a no wrong door sort of organization, and we're always happy to hear from you. So youth-driven, we talked about Youth Move National being youth-driven organization, and we actually have a definition. This was created by a group of young adults and people who work with young adults to create our working definition for what youth-driven means. And what that means to us is that young adults are empowered, educated, and given decision-making roles in the care of their own lives, as well as policies and procedures for all youth in the community, state, tribe, territory, and nation. And this means basically that youth are empowered in their own decision-making with their own treatment plan, that they're also engaged as equal partners within the system, that they receive training in order to participate in these systems, and that when they are participating, that their partnership is valued as equal. So while we are going through our presentation today, Johanna and I will be delivering just a few discussion questions, some thought questions for you all, some thought work. And so if you want to have a place to take notes ready, I am more of a pen and paper kind of person. Some people like to keep notes on their computer. But we're going to be asking some questions. And the first one that we want to prompt you all to think about today is to identify your assets within your community. What are the strengths of the community? Are there resources in your community that might be helpful in having youth engagement in your organization or in your system? And then also thinking about what efforts are already happening within your organization or system. Are there youth councils? Are there advisory groups of parents? Maybe there's a family resource center. A great way to have youth engagement is to learn about other youth-led programs in the community. A lot of times if you bring these families in, they will know other families who are interested in joining and becoming part of that family voice within the systems. So the value we're going to be focusing on today is the role of youth leadership and engagement. So I'll go ahead and pass this over to Johanna to walk us through some content for this value.
Great, thank you. So when we talk about youth engagement as being a core principle of system of care, I have always found myself very passionately called to how good and right engaging young people in our work feels. I think it is also important for us to note for ourselves and for those other stakeholders and allies who will be joining us at our change tables that there is more than a feel-good need to engage young people. We are actually seeing through our work in systems of care and through research in the positive youth development space that we do work better and differently when young people are involved with us. So we think that it's important to call attention to the fact that engaging young people with lived experience will cause changes to happen in both the culture of our practice, how we operate in our day-to-day, and also cause changes to our policies and practices that we document because we've heard and listened to their voices. Bringing young people to the table builds our awareness and understanding of youth issues and concerns, but it also increases the awareness and understanding young people have of their community. I know that we change because young people guide our work. Young people who are invited into change-making space also change, increasing their self-efficacy and understanding and believing that they have the power to make change and to succeed at the change that they are trying. We know that bringing young people to our table improves both the outcomes of our organizations and the services we provide, and also the outcomes individual youth receive as they strengthen their voice in their individual treatment and support circles. And bringing young people to the table, lastly, informs our approach to transforming children's mental health, improving our public policy, and guiding our research and evaluation questions. And it's through all these processes of changing, building, improving, and informing that we can achieve the transformations that we're all working so hard to do. So these are the reasons that we're encouraging you to think about youth engagement today. So a large part of what we want to talk to you today about is some of that when the rubber hits the road implementation ideas. What does it look like and feel like to engage youth within systems of care? And then, as Beth mentioned earlier, provide you a couple of concrete tools and resources to guide your implementation of youth engagement best practices. When we ask a young person what it looks like to be meaningfully engaged in system of care, we hear things like, there are people that look and think like me involved in the planning, meaning there are multiple youth around the table. Youth will tell us it means their voice is being heard, that they feel safe asking questions, that if something isn't working, they're included and able to raise their hand and put that into the space in the discussion. And it's about having a decision-making in their own health and well-being. So we want to talk to you today about how we move from understanding the feel-good nature of youth engagement to implementing it in our practice every day. And we'll start by introducing Hart's Ladder. Madeline?
Okay, so this ladder is developed by a paleontologist named Roger Hart. He wrote a book called Children's Participation, The Theory and Practice of Involving Young Citizens in Community Development and Environmental Care. It's quite a mouthful, but this is basically a framework for the work of young people and adult allies around the world and in the context of a global movement for participation. So what this ladder helps us understand is the continuum of how are young people being engaged in the community. Engagement has different levels, so we want to be somewhere hovering around the top, somewhere between youth-initiated and directed, making sure that we're sharing decisions with the adults and partners, and that we're giving as much power as possible to the young adults within these systems, and avoiding sort of the bottom 7, 8, and 9 here, such as, you know, tokenism, decoration, manipulation. That sort of area is when we just have young adults around to say, to be able to check a box and say, well, we have young people at the table, so we're doing what needs to be done, where really what we need to be doing is moving up this ladder to make sure that we're sharing decisions, that young adults are helping to make those choices, that and that they're helping to do some of the directing. So it's good to take a look at this ladder and think about, you know, where is our community on this ladder, and where do we need to be? So we do have, I'll go ahead and hand this to Johanna, actually.
Okay, great. Yeah, thank you. We wanted to spend a lot of time on Heart's Ladder, but have so much content to cover with you all today. So there will be more opportunities on youth engagement webinars in the coming year to dig into it. We want to share another meter with you. This one is a collaboration meter, and the reason that we're sharing this with you is that we are aware that in the implementation of system of care, one party or parts of stakeholders may believe that we're at a point of collaboration, and another stakeholder group may not feel like we're at the level of collaboration. So the collaboration needle moves from the left to the right, moving from entities or partners who coexist, meaning that they're aware of each other's work and sit next to each other in space, but don't share resources or information. Moving up to communication, where there is awareness of our work and we do share information. Moving over to the right-hand side to coordination, where entities or stakeholders are aware of, share information, and participate in joint processes. And then all the way to the far right of collaboration, where we do all of the things before, but we're also sharing resources and ownership. When we bring youth and families into our system of care work, in the concept of the system of care principles, we are coming to the table in full collaboration with youth and families. What we've been finding through our work with national partners and looking at some of the data from the national evaluation surveys of system of care and the CMHI grantees is that we're hearing actually a disconnect between how some youth and families understand and define collaborative spaces. And when this happens, it means that I might be coming to the table believing I'm in full collaboration. The young people sitting across from the table might be defining collaboration differently and might not actually feel that we've got our needle all the way to collaboration. So it's really important for us all to think critically about our work and to engage in discussion with all of the stakeholders around our table about what it means to work together in true collaboration. And hopefully our introduction of some guiding questions and the youth voice assessment we'll talk about later will help you tease out these discussions. This is a visual that we've been trying to use more often to help for those, especially those of you like me who like to think visually. I oftentimes think about youth engagement as one of many circles involved in system of care. We really like to center today children, youth, and families in the center of the system of care concept, particularly so that you can see how important of a role young people hold in each of the other aspects of the system of care principles. So youth and family have a role in helping our systems becoming more culturally responsive. Youth and family have a role in helping connect our community together to add natural supports into our service array. Youth and family have a role in bringing trauma-informed practices into our fold. And so centering, shifting our frame from young people being a circle around the edges to really putting young people into the center of our work is our goal, again, for today. And then I want to talk really briefly about the fact that when we invite young people into our work it's important for us to shift from a frame of equality to understanding a frame of equity. And this is an image which I hope many have seen on your social media feeds or in other presentations. But you'll see that sometimes there will be stakeholders who are at our table who are supporting with us who will need a couple of extra boxes underneath their feet to be able to play the game that we're inviting them to play with us. And that this is not, if we're stuck in a mind frame of equality and we want to try so hard to be fair and we will only give one box or one resource to each of the partners around the table, we're always going to find ourselves challenged to authentically and meaningfully engage young people. And so a lot of the things that we're going to talk about, particularly as we talk about this youth voice assessment, we're going to be thinking about what are the boxes we should be bringing to put under someone's feet so they can fully participate with us. And so hopefully this image will guide us in that today. And I wanted to provide one other tool for self-reflection in addition to the really great questions that Maddie asked you just a little bit earlier. We really are all engaged in work that is requiring a significant paradigm shift from a traditional fragmented service delivery system into a coordinated service delivery system. And as we go through this slide, there are so many paradigm shifts that are happening, and I'd really like for you to think about where you are in your work today and where do you want to go. We're all coming to the call today somewhere on the continuum of these paradigm shifts of moving from focus on children with the most severe needs and the most restrictive needs placements to a focus on prevention and community-based support. We're all somewhere on the continuum of focusing only on a child or youth to focusing on family units and youth in their communities. And we're all somewhere on a continuum of moving from a culture of creating dependency to one that builds on strengths and resiliency. And this is really hard, complex change work that we're engaged in. And again, it's just worth a moment of self-reflection in thinking about where you are in some of these shifts. Youth engagement and youth voices are vital to each of these shifts. So everything that we've covered so far feels important and foundational to us. We're going to shift our discussion a little bit into the operationalizing section, and I will pass over to Madeline.
Thank you, Hannah. So when we're looking, in this section we're going to talk about what it looks like to actually have young adults and family operating within our systems. So we're going to look at the individual level, the organization, and then the system level. So we think about it in the system level. This means that youth and families are on their governing bodies. They are members of teams that write or review requests for proposals and contracts. Maybe they're members of system design workshop or other advisory boards. They can also do things like raise awareness, and we'll actually get into some of those different roles and what those look like in some of the later slides. And when we look at the organization level, this can mean things like, they're acting as administrators or managers, but making sure that they're really a part of the quality improvement process, whether that means they're on the evaluation team, they're acting as trainers, coachers, advisors, coordinators. And then we have the individual level. This is where family and youth are members of their own teams. We want to make sure that they have a voice in their own services that they're being provided. They can also support other families by being family support workers, care coordinators, peer mentors, and et cetera. So here is this wonderful little graph that we have here. Also, just to note that this graph is going to be available for download in a PDF if this looks like something that might be helpful for your group to be able to look at. But you'll see here we have this red arrow at the bottom, and in this red arrow, some people might recognize this set of values in here, and those are the trauma-informed principles. We have them here because it's important that they exist and be practiced in all of the different relationships that we see here on this slide. And those go all the way from informing on one end to empowering on the other. Another thing that's important to remember about these roles is that family members can serve as in different roles at different times. They can move from one to the other. So this isn't just and the idea where, okay, we need a family member to have each and every one of these roles, that people can do more than one at once. So on this slide, we have here some roles that exist at the system and policy levels, whether that is in education, participating in evaluation, recruiting, training. It's also been really helpful for youth and family members to train professionals. That's something that we did a lot in Indiana. If you have youth and family, that you're able to get them the skills and training they need to help other professionals in your communities understand youth value in their own organizations or et cetera, then it's great to have family representatives be able to come and share their experience and help educate those professionals. Also, one more note about this last slide. This is a great slide to look at to see, are there things, do these already exist in our community, or also are these things that we want to be a part of our community moving forward? So roles at the child and family level, roles that youth and family can play. They can help support with respite services, act as youth or parent or youth peer support. Peer support is really important in our systems right now. They can help support social and recreational activities, help do the family training, support groups, etc. So these are definitely roles that would be great to consider. Is there a way that we can incorporate these roles into our organizations, and can we get families and young adults into those roles? A great way to find young adults that can help support these roles is to partner with youth-run organizations. Partnering with youth-run organizations, they can offer a lot of different support, whether it's just being representative of the young adults. They can help fulfill the roles that you have in your communities at the state level or at the local level. It's great to have youth organizations because they are also amazing recruiters. Young adults are able to bring in other young adults. So if you can find a youth-run organization in your community, if you're a group that is looking for recruitment, you don't have a lot of young adults, which I know is a struggle that we hear about a lot at Youth Move National. Find a youth-run organization and see if they would be willing to help connect you with young adults that might be interested. So just to highlight a few different strategies for building youth partnerships. Again, these slides are going to be made available for you, so you're going to have time to look over all these and decide which ones work best for your group. But to highlight some of my favorite ones, I would say definitely, like I had said on the previous slide, partnering with existing youth groups or youth-led groups. definitely you want to provide some sort of support for young adults, maybe get some training to help them, or have a peer, provide a mentor is really important. And then another great way to increase youth partnership is to require the providers that you're partnering, that work for your organization, to partner with families and youth in planning and delivering those services. So we're going to talk to you all a little bit about the Y-VAL, which is an assessment tool that we've developed here with the TA network. Johanna, are you online?
Yes, thank you.
Awesome.
So one of the reasons that we wanted to talk to you all about the Y-VAL, which is the Youth Voice at the Agency Level Assessment, is that the process of creating the Y-VAL created and developed a helpful framework of key indicators for what meaningful and successful youth voice and youth engagement would look like at the agency level. And so we're going to talk to you a little bit about what that assessment, why that assessment was created, and how you might want to use it to improve and increase and deepen your current youth engagement practices. So, first, a little bit about what is the Y-VAL and why does it exist. We have several youth advisors who provide guidance to our TA strategies and our work here at Youth Move. Then, to work at Youth Move, and they were continuing to remind us that what we're seeing in the field is a lot of good intention of we want to engage young people, and then a lot of questions about, but what does this actually look like, and is what we're doing already enough? Like, if we were going to do something more in our youth engagement strategy, what would it be? So there are many ways that we could respond to this, seeing this need in the field. One of those ways was to consider the development of an assessment where a group of individuals could come together and self-score themselves on their current practices in order to find out where they are and where their rooms for growth are. So that was an appealing process to us, particularly because the assessment you sort of can take ownership of it in your own organization, and we really liked that aspect. So in order to develop the Y-VAL, we first had to establish the list of components that we wanted to measure. And in deciding what we wanted to measure in the Y-VAL, we found ourselves embarking on a journey of documenting what is best practice in youth engagement. So you'll see how we did that as we dive into some more specifics in a moment here. But essentially, we had to first say this is the standard that we want to measure. And so while the Y-VAL is very useful as an assessment in the field, it actually can also be used as a planning tool and a training tool because of the framework that we had to build behind it. And that's really how we're going to be talking about the assessment with you today. So the Y-VAL is also, it's important to know, it's a 360 evaluation. So it's designed for any agency or organization who is currently engaging young people in their decision-making processes. So you as an organization may have young people serving on your board of directors. You may have a youth advisory council. You may invite youth into your quality improvement or your evaluation methods. If you are actively engaging young people in your decision-making processes, you would be a good fit for the Y-VAL assessment. When we say it's 360, we mean that everyone in the organization is invited to take it. That includes the young people who are a part of your councils and committees and advisory structure. That also includes board members, leadership, administrative staff, service providers, etc. And the beauty of the 360 assessment is that we all believe we're doing some things well and could be doing some other things better. We can blend our voices together into the data pool to give us a more comprehensive review. So the goal of the assessment is that you learn both where your strengths are, where you have the deepest youth engagement practices, and it helps you prioritize where if you have resource of time and money to deepen your youth engagement, you can look at your growth areas to prioritize where those resources might go to best increase your youth engagement. So the Y-VAL assessment is available to you all. You can request it on the Youth Move National website, and we can get you that link before the session is over. And then many of you have already made use of technical assistance requests around how to make use of the Y-VAL, and we welcome those as well. I also want to share very quickly that we have a second assessment that's in the works. So the Y-VAL has been fully validated and is a usable tool in the field. The Y-VOC itself is a second assessment, and it is in a validation study right now. So you might be interested in participating in the validation study, or you might be interested in staying posted next spring to know when it is also available in the field. But the Y-VOC is looking at the youth voice on councils and committees. Many of you representing change efforts, system of care efforts, may find yourself engaging young adults at collaborative tables. And those tables are where multiple agencies come together and sit around one table, and youth are providing guidance and expertise to that collaborative table. The Y-VAL assessment doesn't make perfect sense there because each of those individual agencies might have its own structure for youth engagement, but what we really care about is that collaborative space. So the Y-VOC has a slightly different set of domains and components to address this. Some of you might be thinking, as I'm describing those collaborative tables, your system of care governance structure might be a really good fit for the Y-VOC assessment. So I just want you to know that both those tools exist, and we do believe that youth engagement practices need to look a little bit differently in each of those places. So we have a great debt and a great deal of gratitude to the Portland State University team who are our research partners in the development and the validation studies of both of these tools. They started by supporting us in education about what are assessment tools and why might we be interested in them, and participated in a review of all the existing assessment tools to determine that in fact we were trying to build something new that didn't exist in the field already. And then their guidance came to our Youth Best Practice Committee, which was the true heart work of helping us define what are those youth engagement practices that we want to be measuring. And again, they're supporting the national validation study, which is in progress for the Y-VOC. Okay, so what's in these assessments? So the Y-VAL assessment is set up into 8 domains. So each of the boxes on your screen here is one of the domains. So we start in domain 1, looking at the overall vision and commitment, moving to collaborative approach, empowered representatives, commitment to facilitation and support, workforce development, participation in developing programs and policies, participation in evaluation, and leading initiatives and projects. And we believe that young people need to be taking active roles in each of these domains, and the components within each of the domains breaks down what does it actually look like to practice a deep commitment to youth engagement and to have a strong overall vision. We're going to be showing you some of the specific components in just a couple of slides so you can see what that means. So you see the difference between the Y-VAL and the Y-VOC themes. The Y-VOC themes, there are just 4 of them. So they share the first 4 themes, and then the components are slightly different within each of them. Okay, all right. So what I really want to cover today is how, hopefully, to show how valuable it can be to be able to take a look at the components in the Y-VAL, right? So while we love and promote the use of the assessment in its traditional use, we are also excited as we watch organizations use it in the way that I'm just going to describe to you now. So if we take theme 1, which is the overall vision and commitment, one of the components that you would be asked to assess your organization about, and the assessment would ask you on a scale of 1 to 5, how well developed are your formal policies around youth engagement. And by formal policies, we mean, does your agency have a formal policy that describes why and how it involves young people in advising and decision making? Like, did you write it down? Does it exist in words that we could go to a shelf and read? If it does, in this policy, do you describe the types of decision making and advising that youth will participate in? What decisions do young people have a voice in? And does it describe the level in which youth will have decision-making power? So on a board of directors, for example, would the youth representative to your board have one vote on each issue like everyone else around the board table? Or does your organization have a youth advisor or a youth representative on your board, but they do not have voting power on that board? Is that documented in this policy? Additionally, have young people collaborated in developing this policy, and is it periodically updated to reflect new circumstances? And is this policy written in language that young people find easy to understand? So that if you were taking the assessment, you would all be right now clicking 1, 2, 3, 4, or 5. Number 1, this is a less developed practice of ours. We don't have a strongly written policy. To 5, yes, we have a great formal policy. Young people helped us create it. It's easy to understand, and we review it once a year to make sure that it's relevant to our time. So we'd all be clicking one of those buttons right now. And in the assessment, that will give us an important data point. It is also of very strong value to actually just at our decision-making table ask ourselves, do we have this formal policy? And if the answer is no, then we could sit and say, what value would there be in having a formal policy? One value might be that it is easier for young people to say, yes, I would like to participate as a youth advisor, as a youth leader, as a youth advocate in our community, if that young person knows what we're asking of them and what the role and responsibilities and the authority assigned to that role. A formal policy also can provide a great deal of clarity among all the stakeholders around the table. Writing things down, things that are important to our core values, like listening to young people, is important in moving the needle forward on more authentic youth engagement. So even if you don't ever find your agency taking the Y-VAL, then you might find yourself instead dialoguing through each of the components, identifying the components that you could deepen your efforts on, and choosing to flex some of your resources into that space. So I think we said earlier we have too much content and too little time. So what we've done is if for each of the 8 domains of the Y-VAL, we've picked one of the engagement practices in each of those domains and put them on the next 8 slides. So if you download the slide deck, you can see all 8 of those. I'm not going to talk you through all of them. I'm going to talk you through a couple of them. And then if we have time or if your questions dedicate, we could circle back to them a little bit more. We definitely wanted to talk to you about theme 2. So team 2 is about that collaborative approach. And you heard us say a little earlier today that we're seeing in the national evaluation data that young people may rate collaboration within their system of care a little lower than other stakeholders. And we're starting to see through the data analysis process that some of that stems from different definitions of collaboration, right? So being collaborative in our youth engagement practice is very important to our success in youth engagement. So in theme 2, there are several components that are measured. Again, this is just one of the components. And you're going to hear me turning these phrases into questions, and that's intentional. That's how I would use it if I was in a room with you talking about your practices, right? So do you hold youth and young adult friendly meetings? What does that mean, right? Has your agency worked with young people to establish good meeting practices that encourage young people to engage in meeting activities? What does this mean? This means we need to have asked young people, hey, are our meetings working out for you? Do you feel heard in the meetings? Do you feel like you understand what's going on? Would you like us to change something? Right? So we would have had to engage with young people about our current meeting structure. It also means that youth-friendly meetings would encourage young people to engage. One of the challenges, and this is like a very real challenge that I experience in my work with young people as well, I might come to a meeting and I'm really jazzed to hear from young people. I totally want to hear what they're thinking. And we're halfway through the meeting and I'm like, they're not talking. We have youth advisors at the table and they're just sort of listening and following along and they seem very attentive, but I want to know what they're thinking. And so I'll say, what are you thinking? And they pour out great knowledge and expertise that we were missing. What they were waiting for was to be asked, right? But I'm hoping that I'm sitting here hoping that the young people will just show up at the table and pour in and just speak up whenever they have an idea or a thought. But we actually have a different definition or expectation for engagement. So again, this theme 2 in looking at collaboration at the meeting level should be challenging you to think, have we asked young people if our meeting structure works for engagement as they define engagement? The second thing we can think about in developing youth-friendly meetings are, do we practice good meeting practices, including providing the meeting materials in advance? Like, do we have an agenda a few days ahead of time that we can look at? Are our meetings short and efficient, or are they 4.5 hours long that run into everyone's lunch or dinner hour? Do they begin with icebreakers or sharing time, something that would promote relationship building between the attendees? Do we explain our acronyms and jargon regularly? Do we have some sort of ground rules that might say, actually, we don't use acronyms around this table? And do we provide food or snacks or take appropriate breaks for the meetings that we schedule? And if you're like me, you're sitting here going, yeah, you know, I don't always save time. I don't always prioritize time for icebreakers on our agenda. We're so busy and we have so much to do, right? But actually, it's really good practice to build relationship and rapport with everyone around the table, including our young leaders, and so building that into the agenda is important. And then the final consideration in this component is our meeting scheduled at times and locations that youth can attend. The classic examples of these, and they happened when I started as a youth advisor over 10 years ago, and unfortunately they happen time and again. If your meeting is at 12:30 on a Thursday, it means that during the school year, youth who are in middle or high school are not going to be able to attend our meeting. And so if we value youth engagement, we may need to go outside of our way to schedule something outside of our professionally considered working hours and move into the evening so that we can have this really important voice in our space. I think the second thing is that oftentimes we might schedule meetings in that free space offered by our government partner, but is that free space easily accessible by a bus line? Is it a safe and easy place to access when it's dark outside? Is it 2 doors down from the law enforcement center? And are you inviting young people who may not view that as the safest and most comfortable place in their community? I think we oftentimes have a duh moment of, oh, we should totally be meeting at a different time or place. But if we're not asking ourselves to consider if our meeting schedules and locations are pertinent, we may fall into, you know, an on-youth-friendly meeting practice. And the Y-VAL assessment is just, it's made up of, for me, over and over again, all of these, aha, oh yeah, we could do this a little bit differently. And I'm hoping that you can see just in like the 2 examples of taking, again, just one component from theme 1 and one component from theme 2, how even just talking about these things might become a very helpful planning and implementation tool for you. So again, we talked through, and the slides are available for you. You can look at the components in each of the themes. We chose particular components to put on these slides to be very relevant for those of you that are implementing system of care practices right now. And when I stop talking, I'll get you to the place you can request the Y-VAL. So getting almost all the way through. Yes, okay. So the other reason that we really love assessments is the practice of assessment is very important in leadership journeys. And we can self-assess, we can assess our organizations, we can assess the services that we're providing. And after we complete an assessment, we get more data to look at. And that data is the thing that we need to move into a quality improvement practice. So at Youth Move, we love PDSA cycles, which are Plan, Do, Study, Act. And we believe that the Y-VAL is an assessment, a tool in your toolbox that will help you in your Plan, Do, Study, Act practices around youth engagement. So you're planning to engage young people. All of you right now you're doing something. You're engaging young people in your work. If you were to use the Y-VAL as a self-reflection tool or as the full assessment, you would be studying your practice. When you look at your results, you could then act to make an improvement to deepen your youth engagement practices. We also love the Y-VAL. I've been able to work with a growing number of agencies who are using the assessment, and there is a win in there for everybody. There is something we are doing really deeply and strongly. Oftentimes, many things we are doing deeply and strongly. And so agencies, I think, are really finding some gold amongst their Y-VAL assessments, while they're also being challenged to think about deepening their youth engagement practices. As we've said before, we are available as your TA partners and talking through how you might use the components of the Y-VAL in your youth engagement planning is in our wheelhouse and something that we would really like to do. But we are going to shift to the last thing that we wanted to share with you today, which is one more set of tools, a really set of questions that can serve as a tool to support your youth engagement. So what I'm going to do is just frame up really quickly a handout that is available for you in your handout pod, and then we're going to talk through just a couple of examples from these guiding questions about how we'd encourage you to use them in your community. So we worked in partnership with FREDLA, the Family-Run Executive Director Leadership Association, as our partners and your family engagement TA providers. And we did a scoping review of the federal requirements for Children's Mental Health Initiative grants, so the System of Care grants, and specifically what is required of grantees in the funding announcement, so in the original FOA that you were responding to. And there are several components, right, that guide the structure of systems of care. I think that these are very relevant if you are a current grantee, and that they stay relevant as we implement and sustain system of care practices into our jurisdictions long after a specific grant cycle would be done. So hopefully the buckets on the screen here make sense. So there are requirements for strategic planning and structure, for governance, for fiscal planning and sustainability, for service delivery, evaluation, and then communications, partnership, social marketing areas. And so as we looked at all of the components that are really necessary for a sustained and fully implemented system of care, Fredla and Youth Move sat down to think about what does youth and family engagement look like in each of these components. And one of the things we did with our thinking is to develop a very long list of reflection questions. And these questions have a lot of use, and we've used them a lot of ways. Today I'm sharing them with you to encourage you to take these questions back to your leadership, to your teammates, to say, how could we ask ourselves these critical questions, and with our responses plan to deepen our youth engagement. So I think I talk about the first one, and then I'll pass off to Madeline. Okay, so for example, when we are creating our strategic plan for our system of care, or when we're revisiting our strategic plan because we've blown our first 3 or 5 year goals out of the water and we're ready for the next stretch, it is integral. The role for youth and family needs to be integral in the strategic planning process. So 3 reflection questions we would offer to you. First, describe how families and youth are actively engaged in the infrastructure of your system of care. Are there young people at the tables that will be charged with developing and monitoring a strategic plan? Or are young people sitting at another table in another room? And if so, how could we bring young people to these strategic leadership tables so youth voice becomes a part of our strategic plan? Does our strategic plan include components or specific plans to sustain youth and family roles and engagement throughout our system of care long into the future? Did we remember to write goals about youth and family engagement strategies? Without the goal, the questions of will we resource it will come later. And the third question in this area, how have strategic planning efforts progressed to support the long-term sustainability of family and youth engagement activities within the system? So again, this is more, does our strategic plan look at something more than we will have youth and family today? We would challenge you to include, are we investing plans and resources to sustain that youth and family engagement? This, sometimes when we're working with a community, will move from we currently fund a family or youth coordinator or engagement position. For the long term, we would like to shift that to a contract with a family-run organization and a youth-run organization so that they can help us do all of the things that Madeline got to talk to you about earlier in today's webinar. And so the concept of if we have youth and family voices at the strategic planning table, then we'll be able to set these goals with this long-term sustainability mindset. So in the handout pod, there is a handout that's called the Guiding Questions, and we pulled out all of the questions in each of the areas so they're in one place for you instead of sort of back and forth on these slides. And there's a lot of information on these slides, so it's a little cleaner to read in the handout. We share an example here of a logic model that was developed by young people in a system of care community. So this was in their initial year of system of care funding, And you'll see as you look through this, we sort of like made it slightly more generic, so we hope that it would make sense to the jurisdiction that you're sitting in, right? But this is a logic model that is very specific to guiding the vision for youth engagement efforts within the system of care. And in this system of care, this logic model rolled up and fit nested within the larger strategic plan and the overall logic model for the system of care. And this was prioritized in this way because there were so many young people who were at the table to be able to guide this creation. So I think we have a couple of minutes to talk through the next topic, which is on governance. But I'll pass over to you, Madeline, about this section.
Great, thank you. So sort of sticking with the same vein of what Johanna was talking about, we're going to go through some of these questions about guidance that maybe you all can think about in reference to your own organization, and then we'll go a little bit deeper into structure. So, so some things to consider: how are youth and families being recruited for participation? Is there representation on your governance structure? Are the families that are there, are they representative of the youth and families that you serve? And are there families at all levels of the governance structure, whether it's the leadership, management, or implementation? It's also important to make sure you ask, does our governance structure give youth and families authority in the decision-making process, or is this just an advisory role? Like Johanna mentioned earlier, do they have a vote, or are they just there to weigh in? It's also important that you're that you are able to provide the youth and family support to participate in the governance structure, whether that's stipending them, providing gas cards, even just making sure, like Johanna mentioned earlier, are these meetings accessible to families? Are they at a time that youth and families can attend? Are they on a bus line, etc.? So here we have an image of an example of a system of care governance structure. This might be look familiar to some of you if this is sort of how your governance structure works. But at the top, we have the leadership team, generally meeting every other month. This is the governance level. And generally, this would be a team that is composed of different state agency directors. So all of the different agencies that are providing services to young adults, child welfare, Medicaid, etc. You also want to make sure that there's youth and family representatives on this team. And you'll see that that's the theme throughout the rest of this governance structure. There's also a planning group, which has the family organization director, representatives, youth representatives, and providers. Also includes state agency deputies and program managers. And then CQI, the Continuous Quality Improvement Group. Again, we want to make sure that we're seeing family members participating there, as well as in this bottom level we have here in the service level of governance structure. So even operating within, whether it's the wraparound or their own support that they're receiving, that youth and family are able to have a voice there as well. So some more guiding questions to consider as we move forward. Just very quickly, we're going to do an overview. How are youth and families engaged in choosing the services and supports available to them? How are they engaged in evaluating those systems? We want to think about how families are incorporated into different service arrays in the system of care, whether asking yourselves, do you currently or do you plan to contract with a family-run organization, whether that's parent-peer support, other family support services. Also describing how youth and young adults are incorporated into that in the same manner. Or do you plan on contracting or partnering with youth-run organizations? So it's important to make sure that we bring these questions up as we're looking to move forward.
and just a few more guiding questions. So again, these are all components that many of you are familiar with in implementing systems of care, and we're here to challenge you to consider how you can deepen the effort and intention of young people to be engaged in all of these spaces. So moving through like our young people and families involved in developing their outreach and engagement strategies. How do young people participate in the development of your partnership building and establishing agreements between partners about the work? There is such connectivity in the way that we approach this work in thinking about that slide that had all the roles that young people could play in the chart that we shared earlier. That's also one of your handouts with these guiding questions, right? So young people could serve as evaluators. They could assist you in data collection, or young people could assist you in the process of analyzing that data and thinking about what does that mean for us and how might we choose to operationalize what the data is telling us in systems of care. There really isn't a place in system of care that young people aren't value add, that don't have something vital and important to contribute to our work. So I'm hoping that the guiding questions make sense. We would really recommend that you take some time to download that handout in the pod, and then use it as discussion questions in the meetings that you have with your team coming up. We want to take a moment to talk really quickly about the fact that sustaining youth engagement efforts needs to start right now. Actually, it needed to start yesterday, but it's already today, so let's start it right now. And that sometimes it can feel like we are slowly growing our youth engagement and our youth leadership efforts, but if we're only focused on the growth and the development aspects and not on sustaining, we'll find that the fabulous input and advice and expertise that we're getting for young adults will disappear if it's not a part of our overall sustainability efforts. And in order to sustain something, we need to build clarity. We need to define and document what youth engagement is. It's why we started the Y-VAL assessment out with a focus on youth engagement policy. Do we have it? Is it working? Do we improve it? We move on in sustainability efforts to build capacity. How are we investing in individual leaders, into youth-run organizations in order to build their capacity to fulfill all of the roles that we've talked about on this call that they can excel in? And then we need to build a culture, approaching youth engagement as an integral part, both of our core values of our vision for the work, but our expectation of our day-to-day work. So yes, sustainability is about dollars and resourcing youth positions, youth peer positions, youth organizations. It's also about these clarity, capacity, and culture efforts. All right. We couldn't leave you without messages and resources. So Madeline, over to you for a minute, and then we will definitely have time for some Q&A if you want to drop questions into the chat box.
Absolutely. So before we go, some last-minute thought work for you. We are hoping that these groups will have a strategy for youth engagement going forward. And remember that this is a living and growing process. Things will change over time. You want to make sure that you come back and reassess those as you learn and grow. And recognize also that people communicate differently, and try to find a way to provide space for that communication to happen. So we'll go ahead and open the floor up for questions from you all. Please feel free to drop those in the public chat box. Seems like most of you have found that and been able to use it.
Thank you, Maddie and Johanna. This is Denise. I'm going to start. I posted in the chat box that we are getting a lot of great feedback about the Y-VAL. Would there be an opportunity for folks to talk to some other sites that have used it as either a planning or as a tool in its first development?
Yes, I think that is definitely an option, Denise. So I think there's a couple of ways that we could go about that. Several agencies that were connected to System of Care participated in our validation study of the Y-VAL. So there's a robust list there, and then we're actively working in several different states to use the Y-VAL right now. So we have agencies that are, currently collecting data, thinking about how that's working, or working with us right now as a planning tool, as we've been talking about it today. Mm-hmm. So I think a request to a TA provider or directly to Maddie or I is probably the easiest way. And then we'd be happy to set up a peer-to-peer connection or a phone call to talk to another agency about how they've been using that data. We've seen a couple of things happen. We've seen agencies who use it on their own and are very focused on it as one agency. We've also been working in a couple of states where a group of provider agencies who are implementing a similar service would all take the Y-VAL, and then they're using the data both for individual quality improvement, but also for peer-to-peer learning. So then we could see an agency that might have really robust lived experiences in their workforces, very strong in peer positions, in staff training for youth engagement, then can become a peer for an agency who has less developed practices in that area. So that cohort process has been happening too. We didn't plan it, but it's very fun to watch it happen. So yeah, let us know if that would be of value.
That's great.
A related question is, oh yeah, sorry Beth. A related question is that, the uses of the Y-VAL for planning and quality improvement are clear. I'm wondering whether you have examples of places that have used it as part of an evaluation and are thinking about implementing it at various intervals to measure progress in incorporating youth voice and leadership. Have you seen that yet, or is it too early in development? Or
so it's too early in terms of what I can tell you today. We have had state System of Care evaluators access the tool and let us know that their intent is to incorporate it into regular evaluation practices. I haven't seen the results of that or know where the progress is, but we're very interested in watching. We want you all to use the Y-VAL, and we're very interested in watching how you use the Y-VAL and where the Y-VAL goes. So we're doing our own little quality improvement practice in monitoring where the Y-VAL goes and then coming back to you and asking you how you used it. So we have a list of particularly System of Care evaluators who will be circled back to, every 6 months to say, have you made use of that? We do encourage you, and I think this is true of a lot of assessments, to consider taking it more than once. So taking the assessment the first time establishes your baseline. If you choose to take action because of what the data is telling you, then take the assessment again in a year to see your growth and progress.
Thank you. That's great. We've seen something similar with the System of Care rating tool that looks across all of the elements of System of Care, all the values and principles, the services, the infrastructure, and it can be a technical assistance tool like this, but also can be incorporated in an evaluation that can be repeated either every other year or what have you to see changes over time. So I think that would be very useful with the Y-VAL.
Beth and Johanna, and I believe Gwen, who is the co-lead for the YES Learning Community, is on the line too. As Johanna was speaking about the peer use of the tool, both as an assessment and a planning tool, if there is interest from some of you or many of you, we could explore opening up peer-to-peer communication within both the System of Care Leadership Learning Community and or the YES Learning Community so that you could communicate with one another about the use of this tool. So please let us know if there's interest in follow-up. So Johanna and Gwen, while we have you, would you like to share more information about the YES Learning community, as folks on this call may have some colleagues that may be interested in joining, and some of them may be interested in joining as well?
Yes, for sure.
Sure.
So, Gwen, do you want to go ahead?
I'll go ahead and then you chime in, Johanna. We would, the YAS Learning Community, Young Adult Services and Supports, is dedicated to those who are passionate about creating better outcomes for young adults. And that's why we had people join this webinar today. We have organized ourselves monthly to have 3 things, a topic, and in that topic have a webinar, then an office hour where it's just open and informal to talk about the topic, and then thought work that, like the guiding questions tool, I think can be used nicely when you're looking for ways of things to discuss with advisory groups or with your key staff. Johanna, go ahead.
Yeah, everything Gwen just said. We're excited that many of the YAS Learning Community members felt invited and joined us here in this space, and I think we continue to focus on the youth engagement aspects in each of the topics that we touch in the YAS Learning Community. So if implementation of youth voice is important, that's and where you want to learn and grow, that's a theme that you're going to get consistently through our offerings as they move on, and that our learning communities are definitely driven by field requests and responses. So just as Denise indicated, if there is some co-learning, co-discussion space that would be valuable, we would love it. You can say the word or type the word at any time. Yeah.
I think Maddie also is the facilitator of a learning community. Maddie, would you like to tell us about that?
Yes, thank you, Gwen. Yeah, so Jasmine and myself also help to run one of the learning communities online, and it is the young adult learning community, youth and young adult learning community, and we have some awesome resources up there, and they change by the week. So yeah, please feel free to join our youth and young adult learning community. And if you know any young adults in your community that might be helpful for, it's a really great place to find resources and connect with other peers that are doing similar work.
And if you're not sick of me next, they invited me to their webinar in January. So Jasmine and I are going to be talking about many things, one of which we'll spend some time digging into that Heart's Ladder that we touched on very briefly today, and thinking about the Y-VAL components in actually yet a different way and formation. So continuing trying to get those tools and direct resources into your hands. And the youth leadership learning community is such a good place to direct youth peers and youth engagement and youth task leads to. We would love to be in peer space with them.
And this is Denise. If I could just promote that learning community as well. I first met Maddie on when I got to do a site visit in Indiana and got to see work in action, boots on the ground, and was just thrilled when Maddie joined the Youth Move National team. So both her and Jasmine really bring valuable insight through their boots to the ground experience, and that would be a great venue for your young adult leaders in your communities to join as well.
Great. Oh, well, thank you very much for saying that. And they are, of course, also invited to reach out directly if there's ever anything any young leaders in your community need support with. We're always here.
And I just wanted to point out before we close that there are a number of resources on this slide and references on the next slide as well that you can that you can download and access through the PowerPoint that you can download in the box below the chat. So there are a lot of materials there, and also contact information for both Johanna and Madeline if you need resources on a particular topic that might not be included here. So to wrap up, I'd like to ask you again to please hang in for just a couple of minutes longer and use the link that will pop up to complete this very brief evaluation survey. And I'd like to thank our presenters, Johanna and Madeline, for their outstanding work on this learning community session. I think they've left you with a lot of ideas, but also very practical strategies that you can apply in your own states and communities. And thank you also to Tiara Brown from the TA Network for handling all the technical aspects of this session and doing it so well as always. One more plug for the next Learning Community meeting on January 22nd on school mental health and systems of care. Links are in the chat box, and also you'll find them in the TA Telegram. So thanks to all of you for joining us today, and we wish you and your families a very happy holiday.
Thank you.
Thanks, everyone.